Good afternoon. I'm Dave Fitzsimmons, cartoonist, columnist for the Arizona Daily Star, and blessed to be your host today for the Star Reader Chat with, you won't believe this man's resume. Mark Clark is the president and CEO of the Pima Council of On Aging, On Aging since 2014. The man's a former UCC minister. He once ran Kodak for, I think, 12 years. He's on every board in this valley. He has 3 clones currently at other civic meetings right now. Social Worker of the Year in 1809.
Yeah.
Mark Clark, welcome. How are you?
Dave, I'm great. If I would have been smart, I would have looked up the last time you draw a picture of me, but that we're not doing that right now. So
yeah, no, I think it was before you acquired silver hair, which calls to mind instructions. For those of you who might have questions about Pima Council on Aging, feel free to raise your digital hands, the upper right-hand corner of your respective block. There'll be a field of color. Click on that and you'll have choices, among them raising your hand, and or you can simply put your question in the reader chat to the right of your screen. To access that, run your cursor along the bottom black menu bar until you come to chat. Click on chat and then share your question with us. But it's a lot more fun to ask the question in person, so feel free to raise your hands as well. Mark, preparing for this, as much as I already know about this amazing, wonderful nonprofit, I hopped on to your website, which I noted here in the chat, which I encourage everyone to do. And I thought it might be almost cruel to ask you to list everything that PCOA does, but could you give those of us unfamiliar with PCOA what in fact your mission is and what PCOA does?
So thanks, Dave and Sarah. It's great to be here today. It is my most supreme professional privilege and honor to be able to be the CEO of Pima Council on Aging. And I have to acknowledge, I believe at least one of our great volunteers is in the audience. And so Barry probably could keep me honest and point out things that I may misstate. Actually, Barry's not a volunteer, he's a staff person, but he works a lot with volunteers. But we do so many things. So Pima Council on Aging was founded by community leaders in 1967 in response to a concern that really grew up in the mid-60s about poverty and lack of nutrition, a whole series of bad life conditions that older adults were experiencing. And so the summer of 1965, which was a great summer, the Voting Rights Act was passed, Medicare and Medicaid were created. But one of the first things that summer President Johnson did was sign the Older Americans Act, which created this whole federal focus on older adults. And so Older Americans Act is passed. And the community council here in Tucson actually was an organization that sort of got merged eventually to create the United Way. They were a planning organization. They created many great organizations in the community, and PCOA was one of their projects. A lot of people know our first executive director and founder, Marion Lupu. Marion passed away a couple of years, but she worked here 40 years. And then others of you may know my predecessor, Jim Murphy, who for a very long was both a Tucson City Council member and a Pima County supervisor, and then became the first assistant county manager at Pima County. And he was one of our original board members, was the director here for a few years between Marion and me. So we're what's called the Area Agency on Aging. There are 622 area agencies on aging scattered throughout the United States, one in every jurisdiction of the country. And we are charged with being the advocate, the planner of services to, a provider of service, a funder of services for people 60 years of age and older. That's the first population. So the Older Americans Act calls older adults, people 60 years of age and older. Those people who care for people 60 years of age and older. Also, grandparents raising grandchildren younger than 18. So those can be people as young as 50. And then we also provide some limited case management and in-home support services for people living with physical disabilities, as well as older adults. So we use the term older adults. We like that term better than seniors or the elderly. So it's people over the age of 60. That's the focus. We have a whole host of programs and services that we're responsible for. Probably our largest program is our older adult nutrition program. One of them, the one that's most well known, is called the Meals on Wheels program. You're probably aware we're delivering home meals into the homes of about 1,000 older adults in the community. And then we also serve lunch. Well, prior to March 16th of 2020, we were serving lunch, paying to have lunch served in 12 different locations in Pima County. Places like the Armory Park Senior Center, TMC for Seniors, a whole host of other city neighborhood and senior centers, El Pueblo Center, El Rio Center, down in Green Valley at Casa Community Services, or what's now called Posada Life Community Services, also out in Ajo. So we are, by the way, by our name, you can probably tell, we're responsible for Pima County. That's our service area. So last year in our meal program, so let me step back. On the 12th of March, that would be the day that lives a little bit in infamy for us. In 2020, the City Parks and Rec Director, City of Tucson, came over and told us that Mayor Romero was going to announce that the city was going to close the neighborhood and senior centers that night. That was a Thursday. And we said, well, holy moly, that means a bunch of people aren't going to have lunch tomorrow. Can you give us at least until Monday? So we were able to serve lunch on Friday. And over the weekend, our operator of our kitchen, the Community Food Bank, that does that on behalf of Catholic Community Services, was able to convert from preparing those hot lunches to preparing frozen grab and go meals. And so we've been doing grab and go meals since March 16th. People either come and pick them up at the place where they were having lunch, or we get them out. We get those meals out to people. Also, at that point in time, our meal program, both Meals on Wheels and the community lunch program, were 5-day-a-week. So we converted them immediately to 7-day-a-week programs. For our home delivered meals, we actually it took us about a month, but we got 2 weeks supply of meals into everybody's freezer in case we had a delivery or kitchen interruption. We wanted to be sure people could, because about 85% of the people who eat our meals tell us that the meal they're getting from us is their main hot meal of the day. So it's very important nutrition for them. So between those two programs, and then we also use some of our COVID money, our stimulus money, because we got additional money for nutrition. We stood up a restaurant-based program where we're contracted with two different the Cafe at the J at the Jewish Community Center, and then another meal preparation company called Stay Naked Kitchen, and they're delivering meals to 12 apartment complexes that are targeted at low-income older adults. Places like the Tucson House and Craycroft Towers, the city of Tucson's apartment complexes for older adults, and then some other apartment complexes, private apartment complexes. So between all of those programs, last year, that'd be the July 1, 2020 until June 30th of 21, we served 494,000 meals. That's about double what we were doing the year before. So we really ramped up in a substantial way the meal programs. So that's an example of something that happened. I can tell you, I still remember that meeting. I think the guy's name was, well, I don't remember. Brett was his first name, the city Parks and Rec director. He's subsequently left, but when they came over and talked to us. So I have a question that Sarah has put in. The programs funded under the Older Americans Act are not what are called means tested programs. I'm a social worker by training. That's sort of a complicated way of saying there's no income criteria or eligibility for our programs. We do use income and assets as a targeting program, as a targeting criteria, but they are not restricted like the Medicaid program, for instance, or other public assistance benefits. So they're available to all people. Some of them are targeted. The area where we're most challenged right now, and our second largest area of services, is in-home support services. So we have case managers who do eligibility determination for people that reach out to us because they need somebody to come into their house to allow them to continue to live in that house over time. Something north of 85% of older adults tell us they want to continue to live in their home as long as they possibly can. And we know that for some people, that means their house may be modified so that there may be for accessibility purposes. And we are able to do some of that. But for other people, they need somebody to come in and help them, maybe with bathing, certainly potentially with like a little bit of laundry or linen changing, maybe some light meal prep. So we have 13 contractors that actually do those services, and we have right now about 1,200 people that we're sending folks into their homes. It's not very intensive level of services. And I can tell you the biggest challenge we have as an organization is the fact that today we have about 260 people that we have determined that they're eligible, because there is an eligibility criteria for this service, but it has to do with someone's ability to take care of themselves in their home. It's not a financial eligibility.
Well, Mark, it looks like we have a question from Amy Graves. Amy, would you like to unmute yourself and ask the question in person?
Not really, David, but thank you. Mark, everyone. How does what you're talking about, Mark, at PCOA, how does that differ from the in-home services that are considered almost medical and has usually a social worker on the team for in-home services? Sure. And also hospice?
So the in-home support services that we provide or fund are specifically non-medical services. So when you talk about home health, frequently home health services involve things like respiratory therapy or physical therapy or occupational therapy, or maybe a nurse coming into the house to help somebody load medication boxes. This is true with hospice also, or helping people coordinate their medications. So this is all specifically non-medical services that I'm talking about. And I want to just circle back and finish that one last question, that one last comment I was making. 260 people currently waiting to get somebody into their house. because none of our 13 contractors, the providers of those services, actually have a worker that they can send into an individual person's house. So there's a huge workforce crisis among people doing that direct care work. So, so hospice also does, some hospice programs do provide a very limited amount of the non-medical in-home support services. So that's kind of the difference, Amy. I think I just saw a question pop up about suicide calls. We actually are not a crisis line. We do have a helpline, and we got about 25,000 calls last year to our helpline, but it's only a sort of an 8:30 to 5 oriented or operated Monday through Friday phone line. All the people can leave messages and we'll call them back. Those really are information assistance calls. If people are contemplating suicide or other kinds of self-harm, they should call the mental health crisis line in the community, which, boy, what is that? 622. I used to know that phone number, but I don't think I've got it right in my head right now. Maybe we can figure that out and we'll put it up.
Well, it looks like we have a question from Nancy Reed. Nancy, would you care to unmute yourself and ask your question?
Yes, thank you. I'm 75. I lost my job a year and a half ago because COVID closed down my employment. And although I've been applying for work like crazy, and I've had a couple of face-to-face interviews, they all say they're equal opportunity employers, but I question that. So I have that. The other thing is I'm looking around for independent senior facility, and I hate to cook, so it would be nice if I had meals, but I can't afford that. So I'm just wondering, my Social Security is 782, so it's not a whole lot. And I'm just wondering if you could shed some light on that, please. Thank you.
So certainly issues of age discrimination and ageism are of significant concern to us at PCOA, and obviously we don't think that ought to be happening. We do a lot of advocacy work around that, and if you believe you're discriminated against, there are governmental entities you can talk to about that. And so I would encourage you, our website, pcoa.org, has a directory on it, but even probably better would be to call our helpline, which is 790-7262. Again, that's 790-7262. And talk with, and you can talk with them about the housing issue as well. I can pretty much tell you that with your Social Security, sort of basic Social Security income, it's going to be very difficult for you to afford an assisted living or an independent living facility in the community. And so that then would be, you'd find yourself maybe in a situation where you would need to apply for the Arizona long-term care system, which is Arizona's Medicaid long-term care system. It goes by the acronym Arizona Long-Term Care, ALTCS, is referred to as ALTEX by most people in the community. We actually do classes on how to successfully apply for ALTEX because it is complicated. It's absolutely a means-tested program, which means they're going to do an eligibility determination. They also will do a functional assessment determination. And my guess is if you've been out of the house working, you're probably going to be a little bit challenged at this point to qualify for that functional assessment. But I would encourage you again to talk to our helpline. Qualifying for Altex workshop, we have it one video taped and it's on our website, but we also videotaped. Yeah, right. But we also do those classes every other month in person, and and virtually, so that you could talk with someone about that.
Good answer. Mark, how can one stay on top of what classes you are offering? And before you answer that, I want to thank PCOA for their classes I took on Medicare, which I enjoyed so much. I took it twice. That was a great class.
So we have a healthy aging. We have a healthy aging center that our wonderful retired county supervisor, Katie Dusenberry, it's named for her because she's a past chair of our organization's board of directors and nationally very active in older adult issues. And she's been very helpful to us in a charitable way as well. So we're very pleased. We're actually going to change the name of that a little bit. We're going to start referring to it as the Katie, because we think that's kind of a hip name. We haven't told Katie yet. I think I was supposed to make that call yesterday and haven't gotten around to it. But we're pretty sure she's going to think it's fine. So that's at 600 South Country Club. Don't drive over there right now, because that building is actually still not open to the public in general, but we are doing a limited number of classes there. Again, if you go to our website and click on the How Ways We Help, I think that's the name of the tab, you can see our healthy aging classes. And so there's a whole host of them there, Dave. We have exercise classes, we have falls prevention classes. We do these, in addition to the Altex workshops, we also do new to Medicare workshops, and we're just open enrollment starts in 2 weeks? I think open enrollment for Medicare and goes until I think mid-December, early December, and we'll be doing virtual update conferences, having a lot of information about changes in the Medicare plans will also be on our website. At pcoa.org. So, or call our helpline at 790-7262. And Sarah's put all that up in the chat.
Well, it looks like we have a question. That was a good answer, by the way. Thank you for that. It's an amazing range of class offerings.
Yeah.
Something for everyone. We have a question from Chris, who's raised his hand. Chris, would you care to unmute yourself and ask your question?
Hi, thank you very much. Along the same lines of an earlier questioner about keeping seniors in their homes, I'm one of the people whose home was damaged during the monsoon rains. And I live in a mobile home park and attempted to find some sort of program that might help me with a repair or a replacement. And I ended up with the CHARM program, which is administered by the city of Tucson, and was told that they are 2 to 3 years out as far as getting the funding and actually being able to do any repairs for this type of thing. And they referred me to a nonprofit, which also was way out, and they weren't even doing roofs at all because the demand is so high. So assuming that there's a lot of money left over from the COVID funding that the state or the cities are getting, is there any way that that your organization, sir, could somehow lobby to loosen up some of this funding so that the programs for seniors who are trying very hard to stay in their homes can actually afford to do so? I can do a lot of repairs myself, but I can't afford a roof. So if there's some way that PCOA could help us get some of these programs funded so that they can hire the right people, I have a feeling you'd keep a lot of people in their homes.
Well, Chris, thank you so much. And I'm really sorry to hear about your roof. Roofs are a major challenge. We do provide some minor home repair assistance to people, a couple of hundred people a year. But that level of repair, as you heard from the city, and probably my guess is, did they refer you to CHARPA, the Community Home Repair Program? That's a volunteer-based organization that a lot of us use. but the challenge is really the dollar amount. And it's certainly one that we talk about, but it presents a difficult challenge for us because of the amount of money that go along with homes. Especially mobile homes tend to be a little bit even more difficult to deal with. But I would go ahead and call our helpline and see if they've got some better ideas, because I definitely don't know everything. And I will talk to my colleague who does our advocacy work, and we'll start doing a little even more advocacy in that regard.
Mark,
Thank you. I
I'm sorry.
really appreciate it very much. Thank you.
Sure.
Chris, thank you for that question. Mark, I'm wondering, PCOA is such a huge agency serving so many needs in this community, which will obviously just continue to grow. What is your funding mix? Where does it come from?
Well, we're not, saying that we're a huge agency is probably a little bit of an overstatement. I mean,
Enormous, vast.
Vast. There are 200. I had a conversation with our development director who, when I first came here 7 years ago, who said that he was, we have wonderful people who, in those days, we had a membership program, and he was really worked hard to get our 3,000 or 4,000 members every year supporting us. When the support was very appreciative, and some people are still sending in membership money, which we really appreciate. But I said, Bob, why are you into that? And he's so much. And he said, because when you go to the legislature, I want you to be able to say that you're there on behalf of the 3,000 members of Pima Council on Aging. And I said, Bob, I'm going to tell people that I am there on behalf of the 278,000 people 60 years of age and older that live in Pima County, not just the people that are the small number of people that are members. And in addition to that, all of the countless people who love and care for those, 250,000 older adults who live in Pima County. So I take that responsibility very seriously. To your question about our funding, we get funding from the Older Americans Act, which is federal dollars. We get there's a federal formula nationally that allocates a certain percentage of the Congress appropriations to Arizona. Those monies go to the Arizona Department of Economic Security. That's who we're accountable to. And we get about 16% of the dollars that come to Arizona to support people here in Pima County. In addition to those federal dollars, we're also, the state has to come up with matching dollars. And so we get some money from the legislature, and we're very pleased. We just this year got a very specifically targeted $2.5 million, which is the largest increase in state dollars we've seen in more than a decade, to assist with a couple of our different programs. In addition to that, the very generous mayor and council of the city of Tucson and the very generous county board of supervisors of Pima County also fund us. Our dear friends at the United Way of Tucson and Southern Arizona provide us additional support. We get money from charitable organizations like the David and Laura Lovell Foundation and the Community Foundation of Southern Arizona. And then we get charitable contributions from an amazing array of people in the community. And sadly, people are dying, but we are getting bequest income, more of that than we've ever seen before in our past. And so all of that money we sort of mix up and put together going forward to support us. So Dave, it's a whole host of things. We have about in PCOA, so PCOA has gotten a little more complex since I've been here. We have PCOA itself, the Area Agency on Aging. We also are one of the few area agencies on aging in the country that actually owns a non-medical home care company. So we have about 60 direct care workers ourselves, who primarily serve people in the Medicaid long-term care system. And then we just, in April of 20, we acquired the Caregiver Training Institute because of those issues associated with the workforce shortage. So between all of those organizations, we have about 160 employees across the organization. So,
Well,
and a whole host of volunteers as well, I should say.
if someone wants to volunteer,
They could call, probably let's just keep talking about the helpline number, because if you call the helpline number, you can get referred to anywhere.
Right.
In addition to that, I should say that we are privileged to support a group of about 15 or 16 neighborhood-based caring organizations. They collectively, we refer to them as the Neighbors Care Alliance. They're organizations like Lend a Hand, Eastside Neighbors Volunteer Partners, the old Fort Lowell Live at Home program, Freedom Coalition, 29th Street Community Action Network. There's whole groups of these organizations that do a whole host of services, at all really volunteers. We also, through this program, support both Interfaith Community Services and Mobile Meals of Tucson. We're able, one of the things we're able to do there through the Regional Transportation Authority is fund volunteer mileage reimbursement for volunteer drivers. Last year, those volunteers of the NCA affiliates drove more than 430,000 miles, which I always like, it's always good to have a quick fact in your head. That's more than the distance to the moon and back, by the way. Most of them for medical appointments, but for a whole host of, that driving took place, whole host of reasons there.
Yeah.
So
I was just.
And I see my friend, Dave, I see my friend Deb Knox sitting there, and I would be remiss if I didn't give a shout out to Deb Knox and a group of great community volunteers, Tucson Home Sharing, which has really helped us start our newest program, which we're still in the development of, which is creating a home sharing program for Pima County that will help match people who may have an extra bedroom with people who are looking for a place to live. And Deb and her home sharer, Sharon Kaw, have done great, and they're sharing. Oh, I didn't see you there, Sharon.
Hey, Mark, I want to interrupt you right there. Deborah Knox, can you unmute yourself?
Of course you can.
Still can't hear you, dear. And sorry for calling you dear. It's an old habit.
All right.
Hi, Deborah. Hi, Sharon.
Hello.
Hey, so Deborah, why do you do what you do for PCOA?
Oh, gosh. Well, I'll tell you, when Sharon and I discovered the amazing benefits of home sharing, we knew immediately there was no way that these two old ladies were going to be able to pull this off. So PCOA was our targeted organization 4 years ago when we started out. So we are very happy that they have the funding to do this the right way. And Tucson Home Sharing will continue to provide education, outreach, and advocacy. So stay tuned for our public gatherings and our focus groups for homeowners. It is another way of getting help in the home, non-medical, non-household, but a real sharing relationship.
What a wonderful concept. So good to see you, Deborah and Sharon.
So I just had a quick question for them. Is it still best to contact PCOA about the home sharing, or is there a direct contact to your organization about the home sharing?
Mark, do you want to answer that? Because I'm happy to receive your calls between now and January. And
yeah, so it's an interesting question. So we've just got this money sort of under contract in August. And so we have, our commitment to the Board of Supervisors and City Council is that we're going to take at least through the 1st of January, hire staff, develop the program, we're even looking for a software kind of matching program. So if people have houses they're interested in bringing somebody into, we actually are, I think now our helpline is actually creating a list of those folks, the folks with housing resources. What we don't have the capacity now to do, because we know the need is so great, is to start, we're trying to manage people's expectations. So not so much building lists of people who are needing housing in the near term. So those people probably shouldn't call us. I would give you Deb's phone number, but I don't know it, so I'm not doing that. I mean, I probably have it somewhere, but I'm not doing it anyway. But so people could call us. But again, really the list we're working on is people who have houses that they think they're going to be interested in having somebody come in.
Thank you, Mark. Arlene, would you care to unmute yourself and ask your question? There you are.
Thank you. Mark, you keep talking about the helpline, and I just want to apprise you of the fact that I have made numerous calls to that helpline. Number one, I have never gotten a live body. I have left my name, my telephone number, and I've never had a return call.
Oh, well, that's not good to hear.
Well, that's why I thought maybe I ought to bring it up.
Well, so if you want to send me an email, which is mclark@pcoa.org, I will go ahead and walk your phone number back. Thanks, Sarah. Walk your information back and see what I can do. I can tell you, especially during the early vaccination era, earlier this year, we were getting a huge number of calls. We also have changed this all sounds like excuses, which it's explanations. We also changed our phone system out, and that caused voicemail problems for a little bit of a while. So please shoot me an email.
Okay, thank you, because I've tried in the last 3 days.
Oh.
And have not gotten nowhere.
I can also tell you sometimes return calls are out several days, sometimes even as much as a week, because the call volume is so high.
Okay, thank you.
It appears Rosanna Baker has a question. Rosanna, would you care to unmute yourself and ask Mark your question? There we are.
Well, my question had to do with the volunteer drivers. My parents are elderly, and we're kind of going through the process with the VA and Altex. I realized that my mom, who's 83, dad 85, is having a hard time taking dad to all these appointments.
Sure.
And I'm wondering where I could get information on these volunteer drivers.
So the volunteer drivers actually are not PCOA volunteers. They volunteer for these specific Neighbors Care Alliance programs. So you could call it, and they're mostly geographic, although not entirely geographic. So we would, if you could call, again, the helpline, and then we'll go ahead and give you information about the Neighbors Care Alliance affiliates that is in your area, and see if they are taking volunteers or taking new clients. I have to say that a number of those affiliates were pretty hard hit in terms of volunteer loss during the they've had a decrease. Most of them have had a decrease in volunteers over the course of the last 19 months. And so there's a little bit of a challenge in terms for some of them of taking on new clients, honestly.
Well, thank you.
Sure.
Thank you. Arizona, it looks like you have a question. Would you care to unmute and ask away? You just raised your hand, Arizona. Hello.
Yeah, I'm Arizona. Yeah, I've applied for different programs like the matching people with other seniors because I've got a lot of experience in a lot of areas. Also being a former military member and just a lot of experience. And I've yet to hear anything. I was also a member of one of the groups at PCOA, and I've yet to hear anything. I somehow feel that I've been pushed by the wayside, and I'm a little bit dismayed at PCOA. So I'm just wondering what's been going on. And that's it, because I have well over, as I said, lots and lots and lots of experience that I feel is being overlooked. Thank you.
So I do know about your experience, and you and I've talked a couple of times. I don't know that I've got anything else I can say to you that I haven't already said.
Well, Mark, I have a question for you to jump to a different topic, and I don't mean for it to be grim, but I got a text. It was a pretty general question. Any offerings from PCOA related to issues of elder abuse or referral, I would assume?
Sure. So elder abuse is a huge problem in the community. It's also illegal. The sort of first thing frequently I encourage people to do if they suspect elder abuse would be to file a report with the Department of Economic Security's Adult Protective Service. So that's the first area. We have advocates who work in what we call rights and benefits here at PCOA, and they also talk with people and can provide some level of guidance. We certainly are in touch with the jurisdictions, the county attorney's office, the state attorney general's office. The United States attorney has also got a relatively new unit focused on elder abuse as well. Certainly the city of Tucson's police department and the sheriff's office also have investigative units that respond, but probably starting with Adult Protective Services is the best place to start.
So Thomas McGrory, I'm sorry I missed you earlier. He always has good questions, but he had one related to the question of elder fraud. So I guess while we're on the darker side of aging here, we may as well talk a little bit about what PCOA may offer in terms of elder fraud. And also, I'm curious secondarily, if there is any sort of political discomfort, not attacking, but confronting it, say, end of life issues that might be controversial.
We certainly, in terms of, elder abuse, financial fraud is another way, it's another area of elder abuse. It's probably it's the largest area of elder abuse. Tragically, I come from a long line of financially exploited older adults, my mother, her father. It's just amazing, terrible things that people do to older folks to try to take money away from them. And it's a multi-billion-dollar problem. So again, there's a task force in the community where we work with the governmental jurisdictions. We have historically, although not so much in the last year and a half, met with the Attorney General's staff to talk about those issues really at that level. Those are a major issue. The Consumer Financial Protection Bureau, a federal agency, a relatively new one, actually has they've got a host of publications about financial fraud. And we have, through our Medicare counseling program, David, the program you talked about earlier, that Medicare information we do, we've got a specific Medicare fraud prevention program called the Senior Medicare Patrol. So we look at sort of the healthcare fraud and Medicare. We list on our website some of the more common financial fraud issues. Unfortunately, a lot of us fall victims to the same calls. I get a call at least once a month from somebody who's an officer with the Department of Social Security, who wants to advise me about my benefits if I'll just give them my Social Security number. I think my mother's maiden name, maybe, my first pet, and a few other things. Which I'm being facetious, of course, that's a fraud call. I actually was going to a conference, an agent conference, walking into a financial fraud presentation, and I got that exact call on my phone as I walked in the meeting room door. Somewhat ironic. So that's what we're able to do there. We talk with people about it. There's some other great resources for people that live in Green Valley. The Pima County Sheriff's Auxiliary down there does great presentations on financial fraud. So that's out there. And what was the other part? Oh,
the second question was about, I'm curious about somewhat delicate, controversial issues like end of life questions. Does PCOA offer classes or?
So shortly after I got here in 2014, we got funded to start a coalition in the community about end of life care. That's actually turned into one of the largest statewide end of life planning and support groups or efforts in the country. It's actually based these days at the United Way, and includes just a countless array of organizations. My favorite, the group that puts out the best publications I've ever seen is the Southwest Folklife Center, the people that do the 4th Avenue Street Fair, or no, Tucson Meet Yourself, excuse me. So we have several staff people who actually help people do end of life paperwork. People routinely stop by over here to pick up documentations, living wills, advanced directive documents, power of attorney forms. You can actually download those off of our website or the Attorney General's office, the Attorney General of the state of Arizona's office, which is where we get most of our forms. But we also talk with individual people. We actually are able to go out and do presentations in the community about end of life care. Not so much a controversial issue, I would say, but one that we all ought to know about. And it's so important to have our paperwork completed. Some of you may be aware that for years, the Secretary of State's office maintained a registry where you could send your paperwork and then it would be accessible, except we learned over time that it wasn't accessible at the Secretary of State's office. So we've worked with a coalition of groups around the state, and now that whole operation is going to be moving over to something called Health Current, which is the health information exchange in Arizona, where they store electronic health records and share the information. So it's going to be really important to get our records on file, because it doesn't, people tell you to give it to your primary care doctor, but I don't know about you, but I've been in the hospital a couple of times and you never see my primary care doctor when I end up in the hospital. So I keep a copy of them folded up in the glove compartment of both of our cars, in case I end up getting driven to the hospital, then I can actually give it to the hospital. So, but very important conversations, always important, but I think even more important these days. So.
Oh, I could not agree with you more. On a personal note, PCOA helped me with a beloved family member going through end of life issues, and as well as my own Medicare. It's just interesting to me how PCOA can touch people here in this valley who may not necessarily consider themselves as an aging citizen. I encountered and made use of the services when I was much younger with individuals who are aging, of course. Just the breadth of the services that the agency you labor for provides is astonishing. And I think it's also, not to get too preachy here, but it's a wonderful testament to the heart that beats in Tucson in terms of volunteers, for example, that really make PCOA sing. I'm surprised that folks are not peppering you with questions about their Social Security or their Medicare or those.
I'm surprised nobody's asked about boosters. not that I know much about boosters.
That's right. Which calls my question I did want to ask you is, I assume you strive to be nonpartisan and apolitical, but do you have a lobbying arm? Do you have do you engage in a civic fashion at all?
Well, certainly, as you just alluded to, we are absolutely nonpartisan. Small p political, I wouldn't say we're small p political. We actually are, under the terms of the Older Americans Act, we're expected to be advocates for older adults in the community. So, and we do that in a number of ways. We are the long-term care ombudsman for Pima County, which means we've just added 2 additional ombuds folks. So our ombuds people are active in the nearly 600 licensed adult care facilities, ensuring that the people that live in those places know that they have federally protected rights. We mediate in general about 1,000 to 1,200 disputes between residents and facilities every year. We go and visit people. We meet with resident councils. That's one of the ways we advocate. But we also advocate with the state legislature. But again, in a completely nonpartisan way. One of the things that we do a lot of, which is very important, is we talk with candidates for elected office, regardless of the party. We reach out to all the candidates and talk with them about older adult issues. I was just yesterday I serve on the Senator Mark Kelly's senior advisory committee, I guess, or task force. We were a number of us aging advocates from around the state were on a call with him yesterday talking about issues. Both he and Senator Sinema serve on the Senate Special Committee on Aging and are very concerned with older adult issues. I know through most of the pandemic, we were having weekly calls with the staff of Congressmember Kirkpatrick. Now we're down to twice a month calls with Congressmember Kirkpatrick, keeping her apprised of what's going on. That group included hospital CEOs and healthcare executives and labor folks in the Chamber of Commerce and Southern Arizona Leadership Council. So these folks all want to really hear. And so we do our best to keep those elected officials apprised of what's going on when it comes to older adult issues around here in Pima County. And then our colleagues from other parts of the state also participate in many of those things.
Good grief, man. When do you nap?
I don't nap very much.
We have a question from Paula Palote. I liked your question, Paula. Can you unmute yourself and ask away?
Yes, it's just since you brought up boosters, since you were non-medical, I didn't know we could ask because it's still, they haven't given us much information and we're waiting on the CDC, but when they become available, is it going to be a walk-in or do you even know?
Thanks, Paula, for that. I am just a social worker. I'm not medically trained. But I'm on the Pima County Health Department's Ethics Committee and their Community Advisory Committee, and we've worked very closely with them since December about vaccinations. And I did have the opportunity to ask Dr. Cullen, the Health Department Director, about this. Well, she talks about it anyway, but I asked her some specific questions about boosters 2 weeks ago, and certainly at that point, they didn't know much. I believe today that FDA essentially created a emergency use emergency use authorization for boosters for people 65 years of age and older, people with workforce exposures, and people immunocompromised people. That's not the final word. CDC has not clearly weighed in, but I expect certainly I would imagine we'll hear from that early next week. The health department has said, I actually did get an email today, they are not anticipating standing up the kind of mass vaccination process like they did in February, March, April, and May. So it's really going to be pharmacies, I believe. It's going to be pharmacies, healthcare providers, probably, I assume the county will have a couple of sites like the Abrams building, which is their headquarters down on Ajo and Country Club. And I would imagine they may be doing some vaccination down there. But it's again, we're talking 200, certainly more than 250,000 people in that older adult group. We're especially concerned about folks living in facilities because the federal government took care of those people's vaccinations under contracts with CVS and Walgreens. And it doesn't look like they're going to stand that program back up. So trying to figure out how those people get vaccinated. So we really are waiting for more information. But I suspect it's going to be primarily pharmacies and physician practices for most of us.
Mark, thank you so much for answering that question and all of our questions. It's been a great pleasure having you as our guest today.
Well, it's been my privilege to be here, and it's great to see old friends and colleagues and people doing so much important work in the community. And please, certainly Sarah's done a great job of putting contact information up in the chat. You know how to find us. Again, I want to really say thanks to Barry Edward, whose face is right there, and the great work that he does in leading our program, where we do some limited financial, like bill paying service for folks, especially folks with visual impairments. And he works with a lot of great volunteers and probably could use some more.
Remember that, folks. Sarah Brown, who's our guest next week for our chat? Well, can't hear you. Can't hear you.
Thank you. I'm on a roll with doing that lately. I just wanted to echo Fitz's comments. Thank you so much, Mr. Clark, for being here and answering so many questions. So next week, a change of pace from this week, we actually have Michael Conway, who is a research scientist at the Arizona Geological Survey. Yep. So he will be talking about geological hazards that can threaten us, and our property in Arizona. So he'll also be discussing information about landslides, earth fissures, the recent wildfires, and the flood debris flow events. So he's super excited to come. We're super excited to have him. And so it'll be an interesting topic of discussion.
That will be interesting, because I find as I'm aging, I'm experiencing my own personal landslide. Thanks to Mark Clark. Think kindly on PCOA, everybody. Have a wonderful week, and we'll see you next week here at our Reader Chat. Bye-bye and take care.
Thanks.